I would be talking about opening of schools and sending children back to schools. Over the last 2 years, all the children have become homebound, and we as pediatricians are seeing a lot of children with psychosocial health issues in all different age groups, from a preschooler to a toddler, from a preschooler to being an adolescent. The Telangana government has asked us to open up schools from the first week of February, but many schools, the attendance is only around 30 to 45 parents, and parents are still opting for online mode of schooling. The Indian Academy of Pediatrics, which is a central body of all the pediatricians across the country, has formed up certain guidelines to guide us to opening up of schools in our country. So opening of schools should be decentralized. It depends upon the local epidemiology of the infection in that particular community. If the vaccination coverage in the community is less than 60% and there are only less than 20 cases or around 20 cases per a lakh population in the preceding 2 weeks, schools can be opened up and children can be comfortably sent to schools. Prior to opening up of the school authority, the school management should ensure that the school is thoroughly cleaned and sanitized. They should arrange the furniture so that they can maintain a social distance in the school. They should freely distribute or freely make availability of hand or foot operated sanitization in the school. At the same time, the teachers, the IMAs and all people involved in running a school should follow COVID-19 appropriate behavior. COVID-19 appropriate behavior is not only masking, social distancing and following sanitization, it's also vaccination. Every member who's working in the school should be vaccinated, every adult, and at the same time every child who is above 15 years of age should receive COVID-19 vaccination. And schools should work along with public and private healthcare institutes to promote vaccination drive in all their children as well as their teachers, so that vaccination coverage in that particular area is at utmost and reaches almost to 100%. Now once they open up the school, probably the school should open up in batches with the older children coming, followed by the younger classes. And every school should have a sick room, so that if a child who tends to fall sick or has developed fever, cough, cold, can be isolated for other children, and the concerned parent can be immediately informed. And anyone child in the school is tested positive for COVID-19 or the teacher is tested positive for COVID-19, they can follow the national ICMR guidelines of quarantine for 7 days or 3 days of afebrile period. I think the time has come. We should open up our schools. Our children should go to schools. School authority should follow a graded approach and follow COVID-19 appropriate behavior, and ensure that our education of the students, which has got disrupted despite being on online schooling for most of the children in the last 2 years, goes back into what it was prior to COVID. If in that particular community or area, if the vaccination coverage is more than 60% and the incidence of COVID-19 is less than 20 cases per a lakh population, schools in that particular local community can open up and parents can comfortably send their children to school.